Hey guys, my name's Sam and welcome to Prep Medic. This week's video, I'm giving you a full walkthrough of a very compact and sturdy IV lock kit from North American Rescue. IVs are a crucial part of pretty much any kind of patient care, and they allow us to give a lot of different medications, including blood products, directly into the vein where they are rapidly absorbed by the body. So North American Rescue has come out with a really cool start kit that has everything you need to start an IV in a variety of different situations. Now, this kit in particular is geared towards that military tactical side of the house, just because of how it's packaged and some of the things it has and doesn't have, but it can be used in pretty much any kind of situation, including in hospital or on an ambulance. The price of this right here, if you don't have their professional discount, is about $13. If you have their discount login, it costs you a little under $10. So while that is significantly more expensive than buying each of these separately, it is a really compact way to get all the supplies in one place and keep it really safe in just one package. Now, I really like how this is packaged because in a lot of my SWAT kits and stuff, I basically rubber band catheters together, have the in-hospital start kits that have some of the things you need, and then have to get a J-loop and some other stuff, where this has just everything you need right in one place. I will tell you, I made a huge mistake with these a number of years ago on a SWAT call. I bought a couple of these, threw them in my pack, and I hadn't even opened one to see the actual components. The way I was thinking was I had started thousands of IVs. I knew how to start IVs. It was, the procedure is the same no matter what it looks like. But when I opened this for a patient, I had to stare at it for a while and figure out what the components were, because there is a slightly different way to initiate the IV with these supplies than I was used to with the standard hospital supplies. So this video, we're going to go through this kit piece by piece. I'm going to show you what everything does so that you're not surprised when you buy it, and then you can make the decision if this is a piece for your kit that's right for you. So right here, it's North American Rescue products. So right here on the front, you've got everything that comes in it listed out, which is pretty cool, and it's nice to just know what you have. It's got your big old expiration date up here, and this one expires in 2025. So they do have a pretty long shelf life. I think when you get them, it's like 3 or 4 years, I want to say, because I bought this a little while ago, and it still doesn't expire till next year. On the outside of the package, you've got red tabs that indicate everywhere you can open it. I'd recommend going to the top here because none of the supplies are up at the top. Now, the back is clear, so you can kind of see some of the stuff inside of it. It is vacuum sealed, and this is a very sturdy packaging, so I don't think this is going to go anywhere if you have this on your pack. I don't think it's going to get really roughed up or come open on accident. So as we open this right here, top comes off nicely, and everything kind of remains in the package, which is really nice. You can pull it out one by one, or you can kind of reach in and grab it all out at one time. So we'll reach in and get it all out right there. And let's go through the contents. So first and foremost, you've got this little guy here. This is a lure lock that basically just keeps blood from flowing back, but you can secure a syringe on it and push whatever you need. You can also attach IV tubing directly to it. This is a replacement for a J-loop that we're very used to seeing in EMS. Some people call it like an extension set something. It's the little loop that goes up there that you push through. This is just a lot simpler there, and you can cover it all with a Tegaderm if you want to keep it totally clean while you're in a nasty environment. We'll go through how that's used later. We've got a needle. Now, this isn't for your actual IV access right here. This is actually for prepping a saline flush with your 10 ml syringe. We'll talk about that as well. We have a tourniquet. This is not like the tourniquet you're used to seeing, this cat tourniquet. It's not to stop blood flow. This is to stop venous return to the heart. So if you know how to start an IV, you know what one of these is. It's probably stupid that I'm going over this, but essentially it stops venous return. So you've got arterial flow in, no venous return or less venous return. It pumps up the veins a little bit. It's a little bit easier to see and stick. You have gauze pads for cleaning the site, which is important. You've got a gauze pad for cleaning up a little bit of extra blood, or God forbid if you miss, this is a great way to cover the site. Not that I've ever missed an IV before in my life. And then you have a Tegaderm to cover the site, and you can cover it in a couple different ways. You have their Raptor IV securing band, And this is cool because this right here can be used without any adhesive. So if you're in a combat environment, which is dusty, grimy, gross, bloody, a lot of like standard adhesives aren't going to stick, and this will allow you to secure the IV in place with this band. Now it's nylon here. There's a little bit of adhesive on the back, so you do get that a little bit. And then you have Velcro, so it will Velcro over on itself, making it really easy to use. And last but not least, you have one 18 gauge needle. So obviously you could miss. I personally, when I use these in the field, will stick like a 20 gauge needle. I'll tape it to the outside just in case I need something just a little bit smaller. There's a lot of arguments on catheter sizes. 18 gauge is literally good for everything. Now, obviously, the larger catheters will give you a higher flow rate, so your 16 gauge IVs are great, your 14 are great, but you have a much higher chance of blowing the vein. The vein might not support those larger sizes. I like 18 as kind of a good compromise. You can still do rapid transfusions of blood. And honestly, 20 gauges work just fine too. They're just a little bit smaller, especially in these trauma situations. Gone are the days of 2 14 gauges IVs in both arms and saline wide open. We're just not doing that anymore. If we're resuscitating with fluid, we're using blood products. Hopefully we have a rapid transfuser with that. So how does this all work, and how is it going to come together for us? So we can prep everything we need for this. This is a needleless one. You can get one that doesn't have a lure lock. It's for a needle insertion. I like the lure lock because it's compatible with these guys and you just have less needles floating around. But this right here is to draw off your bag. So when you prep this, you do want a saline flush ready to go, although you don't need to prep it the same way you do in a lot of different situations. So we can open both of these guys up. We attach the syringe to this, and then we can take our bag of fluid. Ignore that this is 10% dextrose. It's just what I had lying around. You can go into the needle port in the back, and you fill this in with saline, and this is your saline flush. It just keeps you from having to travel around with a pre-filled saline flush. These take up a lot of space, and they kind of come with their own expiration date. So if you already have a bag of fluid, which you probably do, you just make your saline flush with that, and it's really, really easy. So we've prepped that right there. Now what we can do is we can take this guy here. This is that little lure lock. And we don't want to like just be tapping all over it. Technically, this end here is going to be the sterile end. This end here is not technically sterile. We just want to wipe it with an alcohol swab before we use it in any situation. Now, granted, that's best case scenario. There are definitely times where people don't. I'm not condoning it, but I'm saying it happens there. We've got the alcohol pads for cleaning the site as best we can. I like to always open the Tegaderm and get that ready. So we can put that right here. Now this isn't an IV start class. I've got another video on that and I'm thinking about redoing it. But I just want to show you how this actually comes together to start an IV. I always open my gauze pad because once again, you could miss. My comment earlier was sarcastic if somebody's getting mad down in the comments. I miss IVs all the time. Especially now that I'm on a helicopter, I just don't start them all that much. Most of the time somebody has them started before I even get there. So we have that there. And now last but not least, we've got the 18 gauge needle. Now, these needles are safety needles. They don't just pop right out of the catheter, which I'll show you that mechanism in a second. This one's 18, you can tell because it's green. And then obviously it's got its flash chamber here. It's kind of a standard length for you. So when you're prepping this, obviously we want to keep it in the case, keep this out of grime if possible. I'm only going to pull it out of here right when I'm ready to start the IV. Now, don't do this in real life because it can result in a stick. I'm going to resheath it right there for a second. Now, standard practice in like EMS would be we'd want to fill this with saline, flush it with saline. The amount of air in here and air in the needle is so tiny that you really have no chance of causing an air embolism by flushing it with the air if you did that and you forgot to do the draw like it says, or the IV doesn't draw very well. So they do say draw some up first, don't just flush it through. I'll tell you that to cause an air embolism, it takes almost 100 mLs of air. It can take less, so we want to get the air out of there, but it's not something that if you put like, this is probably like maybe 0.1 mLs, that's not going to cause an air embolism for your patient if you flush it through, which is kind of nice because you don't necessarily need a saline flush right away, although it does help you confirm the IV when you start it. So that tangent aside, the next step here is we'd take this guy, we would thread that into the opening. Now you'll see here when I pull this out, it's going to cap itself as we go. So obviously we start the IV, that this catheter is in place. This is the bendy end that stays in their arm. And now this guy is capped. So it's not risk-free. Obviously, if I just messed with that a ton, I'd end up sticking myself with the needle. But now this guy is out and it's safe to use. There's no springs or mechanical mechanism. It just catches that on the way out of the catheter. I'm going to hold tamponade, and then I'm going to take this guy here and secure it on the IV. Now, obviously, this is sitting on somebody's arm just like this. Now, we have that saline flush, so you don't actually need the needle on it anymore. I'd recommend disposing of that properly. You can take this on the Luer lock here, and then what you can do to get that excess air out of there is you just withdraw. So you just withdraw a little bit on that. You're going to get some blood through there. The air is going to go up to the top of the syringe, and you can flush 5 to 10 mLs through it to make sure that the IV is established and appropriate. After we do this, we can take the Tegaderm. Now how you do this will depend on what kind of operational environment you are in and how you are trained. So with this, my practice has always been I put it just over at least where the hub enters the skin. That's important because that's where it's going to stick. So here, I'll do it on the table here, and that'll be impossible to take off. So I'd put it like right here, and then I still have access to the hub itself. However, if you're in a combat environment and this IV is going to get like grimy and dirty, you can cover the whole thing with it. Now, this was practiced more so when it was a needle port in here and you'd stick a needle through the Tegaderm. In this case, if you're not going to use it right away, this will just keep the whole thing clean as you pull these sides away, and then it will allow you to access that at a later time and not necessarily have to scrub it, although that is still standard of care. You'll notice down here, it's still protecting the insertion site from infection and outside material. If you're going to give it in the Luer lock, you would have to peel it up, so obviously that's not totally ideal. As for securing it, this is the Raptor IV securing device, and it's not quite as intuitive as you think it might be, although it does work very well and it's quick once you know it. So on this side, you have adhesive. I already kind of gummed it up, just like experimenting, pulling the paper off. So there's paper on it, but don't mind that. That's actually going to go up on the hand, and the Luer lock is going to sit just on the top of that. And then the next thing you're going to do is you're going to take this guy and you're going to wrap it around that and then pull it tight at the very end. And that's going to secure the IV in place. Once again, these are super important because if you're in an environment where a lot of the adhesives aren't going to stick, this will. This will secure your IV even if the little adhesive on it doesn't work at all. Everything else in the kit is pretty intuitive. You've got these alcohol swabs and you've got this guy right here and your tourniquet. A couple things right at the end here, just because I get a lot of questions and confusion about this, is that when you go on North American Rescue's website, it'll say, hey, do you have MD authorization to buy this device? This is a cover their ass statement for North American Rescue, and you should have medical authorization before you buy it. There's not going to be an investigation launched against you if you click that and you don't have authorization. But if you start an IV on somebody, they get like a massive infection and die, and it comes out that you bought this, nothing's going to fall back on North American Rescue because you technically did that, out of scope. And IVs are not something that are probably going to be covered under Good Samaritan laws because it's not a really basic procedure and there's a lot that can go wrong with it. So know that anybody can buy it, but technically you do need an MD authorization to get it. Now, the second thing I want to talk about is like the efficacy of IVs, because I know like a lot of people watch my channel for the prepping aspect, and I really like it. That's awesome. That's one of the reasons this channel exists. And IVs definitely do have a place in prepper medicine, but I think their utility in these situations are greatly overestimated. We know in trauma that any amount of normal saline or lactated ringers, anything like that we're giving in the IV is almost completely useless. Gone are the days of trying to get blood pressure up with a liter of saline. We know that dilutes the blood, it pops clots, so it just diminishes the blood's ability to form clots. And also saline doesn't carry oxygen, so great, they've got a higher blood pressure, they're getting blood other places, but it's not really blood, it's what we call pasta water, so it's just salty water that's not carrying anything that's actually helping the patient. So we don't really do IV fluids in trauma anymore. We try to go directly to blood when it's available. So in other words, these IVs are going to be really useful for you if you have somebody that's hypovolemic from dehydration. My example would be after my last marathon, I got to the end, was okay, and then had a massive drop in blood pressure into the 60s. Was really nauseous, throwing up, was cramping, had a bunch of issues after that. So I got an IV and a liter of saline. That really helped because hypovolemia from that dehydration and that lack of salt, hyponatremia really kicked my butt. That's when this will be useful. Or if you have specific medications for an IV, you know, in trauma situations, TXA, calcium are commonly given a lot, although their use on their own without blood products is still being studied. But like I just said, if you do have a traumatic situation, you're training for like, hey, this is shit hits the fan, somebody shot, they lost a lot of blood, saline's probably not it, and the usefulness of this is overstated. So a little bit long-winded, but with all of that being said, if you have any questions about this product, leave them in the comments down below. I will leave a link in the description. I should also mention that I'm not sponsored by these guys at all. There's a lot of different companies on the market. North American Rescue won't even return an email when I asked about it. So if you know somebody that wants to hook me up with sponsorship, that's great, but I don't get any money from these guys. So with all of that being said, I will see you next week.